Welcome to Towson University for the 4th Annual Maryland Workforce Outlook Forum. I am Darius Irani. I'm the Vice President for Strategic Partnerships and Applied Research. My colleagues at the Regional Economic Studies Institute have been examining the information you will hear today for about a year now. Their independent research is based on prior research using the UN's Human Development Index that measures outcomes and ranks countries. Using the same analytical techniques, RESI has examined every census tract, there's 1,400 of them, plus or minus, in Maryland, and constructed an HDI index for each one. RESI is now able to compare these tracts across the state, and the results and the ensuing analytics will be revealing and hopefully will spark some conversations and some solutions. Following that, we'll have a wonderful panel of 4 individuals who are providing solutions to help address some of these outcomes. Again, thank you for attending. Your dedication to finding collaborative solutions for our state is a key step in this process. Today is just a start. We're thankful to our sponsors and partner, the Maryland Governor's Workforce Development Board. Mike Sires, Director of Research, will present RESI's finding in just a few minutes, but first I'd like to introduce my boss, Dr. Kim Schatzel. President Schatzel began leading Towson University as its 14th president on January 26, 2016. She did bring a major winter storm with her from Michigan, so we thank her for that because the university was closed. Yay. Her eight presidential priorities strategically build on Towson University's momentum as Maryland's second largest and fastest growing universities. I often refer to it as we're the largest university in the greater Baltimore region. During a tenure, TU, with more than 190 partnerships at work, has strengthened its commitment as an anchor institution for the greater Baltimore region, established the Office of Inclusion and Institutional Equity, and hired the university's inaugural vice president to lead its advancement, and embarked on a strategic communication strategy to retell the contemporary story of Towson University and its significant positive impact on Baltimore, Maryland, and the entire Mid-Atlantic region. President Schatzel is one of less than 2% of university presidents that have extensive business and private sector experience, spending more than 20 years as a corporate leader and serial entrepreneur in the technology and advanced manufacturing sectors, including serving as founder and chief executive officer of a multinational manufacturing firm on 4 continents. So without further ado, I'd like to call President Schatzel to the stage.
Good afternoon, everyone. I always, when I listen to my introduction, I always like to hear serial entrepreneur, not serial murderer. I mean, I always wait for that mistake to be able to come through. But I want to thank everybody for being here and welcome you to the 4th Annual Maryland Workforce Outlook Forum and to the partner that we have and that we are so pleased to be able to be working with, which is the Maryland Governor's Workforce Investment Board. Darius talked a little bit about our commitment to workforce development as well as economic development. And we are an anchor institution, as Darius pointed out. We are the second largest and fastest growing university in the state. We are the largest university in greater Baltimore, and that is public or private. And I don't know if any of you were looking uptown in Towson and saw how many cranes are up there right now. Anybody see them? So I count them every morning. So there's 7 cranes that are up in Towson right now and on our campus. And if you take a look at the investment that's being made at a quarter-mile radius at Burke in New York, there's about $1.7 billion of investment being made. And I believe, and I hope Darius can back me up, that that is the largest per square foot investment in the state of Maryland. And we are quite proud of the fact that we are part of it and that we are a driver for it. And before I go a little bit longer, there's a question I always ask. Can you please raise your hand if you are a Towson University alum or have a family member that's a Towson University alum? Look at that. That's what it's all about. So make sure before you leave you introduce yourself to each other. We are a talent pool provider in the state. We are deeply committed to it. We have over 86,000 alumni that are in the state. And as Darius said, we focused on inclusion and diversity as a priority for us. And today we're going to take a deeper dive into examining that. I can also share with you the fact that it's an important process that we go through. We take it seriously. And we are very excited to be hosting the event again this year and having the topic of what it is and that it represents the values of this institution. So with that, thank you very much for being there. Please enjoy the forum today. I know that it will provide lots of information that's very valuable to all of us. Thank you.
Good afternoon. So my name's Michael Sires. I'm the Director of Research for Towson University's Regional Economic Studies Institute, as Darius mentioned. And today is kind of a bigger day for me here at Towson. It's my 3-year anniversary, which is great. And I actually started 2 days before the very first one of these, the very first Maryland Workforce Outlook Forum. And I know that it is the cliche that you hear every single person that ever gets up at a conference say, but this is my favorite event that we do here at Towson. It's really, really cool because we have in November every year, which I hope everybody here goes to, but we do our Economic Outlook Forum. And so we talk about our broad forecast for what employment is going to look like in Maryland over the coming 3 to 5 years, look at these really big macroeconomic trends. And then here in May, what we do is we kind of focus in a little bit smaller and we say, okay, there's going to be 3 or 2 or 5% growth over the coming years. What does that mean for different populations? And so we've really done a lot of work here. Our first year, we focused in on occupational gaps across the state. In the second year, we focused in on a neurodiverse population, on opportunity youth. Last year, you may remember if you were here, we talked about occupational crowding, the way that people in different racial and ethnic groups get crowded out of high and in-demand occupations. And today, we're going to be kind of extending some of our analysis statewide. So many of you may have seen our webinar in January. If you haven't, we'll be sending out a link to that in kind of the post-event communication. So I hope everybody gets a chance to look at that. And what we did is we looked at disparities within Baltimore City at the neighborhood level. And really today, we're going to be extending that statewide to look at variations across Maryland. And this is really, really important because one of the big refrains right now is that economic development is workforce development. And I think everybody in this room is probably aware of a company called Amazon and the kind of craze that happened around the search for HQ2. And there's obviously a caveat here for Long Island City, New York, but Amazon eventually ended up settling on 2 locations for their headquarters. And the reason that they selected Crystal City, Virginia and Long Island, New York is not because they ended up getting the largest tax incentives. In fact, it wasn't that they had to choose between an $8 billion package in Iowa or a $7 billion package in Virginia. The 2 largest tax incentives were actually right in between Crystal City, Virginia and Long Island, which belong to here in Maryland, and the state of New Jersey. The reason that Amazon eventually selected Crystal City and Long Island City is that those areas really had the workforce that they needed. They didn't have to worry about, would they be able to find the workers that they could staff, their headquarters with. They knew that that's where there was a really great concentration of high quality workers that could come in. And this is not a new, thing that we've been seeing. So this is just over the last 10 years or so post the Great Recession. You can see that the share of job growth across the country has been almost entirely within metropolitan areas. So we're seeing that areas of the country that are more rural or more micropolitan, these small towns, they're really struggling to kind of tap into the national growth that we've been seeing. Because what's happening is that businesses and employers and all of the different drivers of growth are really focusing in on where is the workforce? Where can I find people that have the skills that I need? And that creates this feedback loop, right? So you have people that are going to, say, the DC suburbs or Howard County, because that's where the high quality workforce is that they want. And then people move to be closer to their jobs, and then more businesses locate there. And what you have is this kind of share where the population is starting to fall in our rural areas, where disadvantaged areas of our cities and urban areas are not sharing in that same growth. And so it's really important that we kind of think about, where are the jobs, where are our kind of, our levels of education, our income, how does that vary across the state? And I think when we're thinking about our workforce, it's important to realize that there are gaps in opportunities and that really takes a lot of different forms. So when we're thinking about economics and we're thinking about this event and the Regional Economic Studies Institute, obviously there are going to be economic disparities that we're looking at. There's going to be differences in the incomes that people have and the wealth that they hold. But there's also a variety of different disparities that we need to look at and make sure that we capture. So there's education disparities, there's health disparities, how long people are living, are they located next to a power plant or other source of pollution? There's criminal justice disparities. Are people in different areas or people who hold different characteristics? Are they going through the criminal justice system in the same way? And you can look at this across a variety of different lines. So you can look at this for racial disparities, which is again something that we here at RSI have been trying to focus in on more and more. There are gender disparities, there are geographic disparities. And one way that we can really think about combining all of these disparities together and is not just by looking at any one single metric. So again, we don't just want to focus in on income. We don't just want to focus in on education. We want to look at some sort of measure that combines everything together. And one of the great ways that you can do that is the United Nations has kind of pulled together this index that's called the Human Development Index. And what it does is it focuses in on 3 different areas. It focuses in on whether or not people have a long and healthy life, which is measured through their life expectancy at birth. It looks at the knowledge base, so that considers the mean years of schooling that someone might have, so educational attainment, as well as the expected years of schooling, so that's really looking at current enrollment levels. So are people enrolled in school so that the workforce of the future will be there? And then finally, you have a high standard of living. So you want to make sure that people have an income that allows them to purchase goods and services, to care for their families, to be able to have a high quality of life. And so just to put this into a context, so the UN has kind of released reports that looks at this at a countrywide level across the world. And so in 2016, the United States ranked 10th. In 2017 and 2018, we fell down a little bit to 13th overall, but still pretty high. And I think it's really interesting, though, when you drill down into some of these numbers and look at the 4 different metrics that kind of feed into the overall HDI score. One thing to note is that the life expectancy in the United States is 79.5 years, which is pretty decent, but that's 33rd in the country. In the world. And that's really apparent when you look at things like our mean years of schooling. The educational attainment present in the United States, we're a very educated workforce, but we're still falling behind in a lot of ways. And so this is, if you saw the webinar, which again, I hope you did, but just to kind of catch everybody up to where our research has been, this is looking at the Human Development Index at the Census Tract level. So the UN only captures this at the country level. There has been research that's looked at this at the state level, but we really wanted to go a little bit deeper. And so we looked at neighborhoods which were defined by Baltimore City. They are kind of a combination of about 2 to 5-ish census tracts each. And we looked at how the Human Development Index ranges. So green, the darker the green, the higher the Human Development Score. The darker the red, the lower the Human Development Index for that neighborhood. And you can really see, if you're familiar at all with Baltimore City, which likely everybody in this room has some sort of passing familiarity. We're only about a mile or 2 from the city line. I don't think that this map is really that surprising to any of us. You have neighborhoods like Greater Roland Park and Poplar Hill that have an extremely high Human Development Index score. If Greater Roland Park, if that neighborhood was a country, it would have a higher Human Development Index score than any country in the world. The closest comparison would be Norway. But if you just drive a few miles south to Upton Druid Heights, that's the overall neighborhood in Baltimore City that had the lowest Human Development Index score. It's closest to Tunisia. And so you see these really huge disparities that really just go even a couple blocks. So in the webinar, again, I won't bore everybody with all of the details, but there are neighborhoods in Baltimore City that are right next to each other where the difference in life expectancy is up to 20 years, which is ridiculous. But it's the city that we live in. And so what we wanted to do is understand if these disparities are present across the state. Understanding that if our economy statewide is going to really function, are the problems that we see in downtown Baltimore, are they the same that we see in downtown Hagerstown, in Salisbury, in Cumberland, in Frederick? And so what we did is we took a look again at census tracts all across the state. We used a variety of different resources. There's life expectancy estimates at the census tract level that are put out by the CDC. And we used a lot of data at the 5-year level to try and get a little bit more information and data points in and correct for some outliers from the American Community Survey. And the reason that we did this is we wanted to go down to the census tract level, because if we just look at statewide, this doesn't really tell us anything. It's just kind of, they've got a green. It says that Maryland as a whole is doing pretty good. If we go down to the county level, you're going to be able to see a little bit more detail here. So you can see, probably not that surprising, Howard County, Montgomery County, there's some really dark green pockets. There's a lot of wealth, a lot of education there. You can see Baltimore City is struggling compared to the counties that surround it. You have a lot of some lower HDI and more rural areas of the state, especially Western Maryland and the Eastern Shore. But to really get the full picture of what's happening, we want to go down to the census tract level. And so looking at the variations across the state at the neighborhood level really let us kind of see what's going on a little bit more. You can see pockets of green, pockets of red, surrounded by other colors, and you can really start to say, okay, well, what's going on here? Out in Western Maryland, I'll give a little sneak peek, but you can see right at the end there is Deep Creek, that pocket of green surrounded by red. So, how can we take Deep Creek and use that as an economic engine to help drive Garrett County more broadly? And so that's really important. And I think one of the main takeaways as you look at this map, there are a lot of colors. So we're going to kind of take it slow, go region by region, because it's a little overwhelming to look at all at once. But I think the main thing is when you're thinking about what areas of the state are doing the best, it's really concentrated. So this is the 150 census tracts in Maryland with the highest Human Development Index scores. And they're really concentrated in the I-95 corridor. You can see in the top there is Baltimore City, the Roland Park area, going up north into Baltimore County. Then you have a little bit lower, you have Howard County, so you've got Columbia, Ellicott City. Down below that is Montgomery County. The interesting thing too to kind of point out here with Howard County and Montgomery County is that those two counties are not really linked. There's that little gap in the middle. So you do have along I-270 as it connects DC to Frederick. You are able to kind of see there's some lower HDI scores right along the interstate there, which is just another interesting takeaway to point out here. And similarly, as you have pockets of high Human Development Index scores that are concentrated, the lowest scores are also very concentrated. So this is showing the bottom 150 census tracts in the state, and you can see that they are almost all right around Baltimore City. You have pockets out that's Cumberland, out in the very far west of the state, and then followed by Hagerstown, and then down on the Eastern Shore, you can see some pockets in downtown Salisbury. But really, it's Baltimore City that has some of the lowest outcomes statewide. But not just to kind of dwell on Baltimore City, but if we expand this up to the 300 census tracts with the lowest scores, you will see that issues are still pretty widespread. So, there are pockets of rural Maryland on the Eastern Shore and Western Maryland that are struggling with this, with all of the issues of low educational attainment, low school enrollment, low incomes. And you can also see that in some of the more suburban counties, especially down in DC. So you can see in kind of northeast DC there, you'll be able to see some of these pockets of lower Human Development Index scores. And so to kind of look at this at a regional level and go a little bit slower, we can kind of, look at different areas of the state. We don't get into every county here, so don't worry. But if there's something that you're interested in, please find me afterwards or send me an email, and we'd be more than happy to kind of show you our data and results and talk through what things might mean. But in looking at Baltimore City and Baltimore County, this map here very much mirrors the map that we showed earlier that looks at just Baltimore City at the neighborhood level. You can see the dark areas of red in the inner city of Baltimore. However, it's obviously split by that corridor of higher outcomes. You've got right down in the Inner Harbor, you've got some more pockets of green. But I think the interesting thing is that, a lot of times when we talk about Baltimore, you hear Baltimore talked about in the news, it kind of sounds like a lot of those issues just sort of end at Baltimore City, and Baltimore County is, a completely different place. And while that's true, if you look at it at the county level, if you look at it more at the neighborhood level, you can see that, those issues that are in West and East Baltimore are spreading out into southern Baltimore County in both the southeast and the southwest. Those pockets of concentrated wealth and really high incomes and outcomes, those are extending, sure, they're in the kind of north middle part of Baltimore City, but they're also extending out into northern Baltimore County as well. And so to kind of highlight some of the discrepancies and the disparities here, you have Worthington Ridge, which is a census tract that has a HDI value, for those of you in the back, that's 0.9788. So it's very, very high. Practically perfect. If it were a country, it would be way above Norway, the best country in the world. This is the home to Joe Flacco's mansion that's just up for sale is there. Adam Jones just bought Cal Ripken Jr.'s house in this census tract, right next to Caves Valley Golf Course and Oregon Ridge. But a few miles south on 83, not very long if you're just driving and there's no traffic accident for once, you'll get to the neighborhood of Poppleton. So this is where Poe Homes is. This is an area that has the lowest HDI for any of the non-prison census tracts in the state of Maryland. And it is not very far at all from one of the wealthiest areas of our state. And I do kind of want to also highlight that there is a little kind of pocket of red up here that is where Towson University is. And I just kind of want to use this as a one bit of cautionary advice for interpreting individual census tracts and the results at the tract level. So if you look at this, you'd say, oh, wow, there's some dark red there. Towson University is kind of struggling. And it's really just because we have a lot of students here, and students don't have incredibly high incomes, which I'm sure doesn't surprise anyone. It's hard to calculate life expectancy when your population is all 18 to 21. And so it looks a little darker there. And so really what you want to look for are more of the patterns that you see on a larger scale. To kind of put this in the country level, this would be the equivalent of moving from Norway down to El Salvador. And to really kind of just hit this home with another data point, for per capita income, the per capita income in Worthington Ridge is very high. This is, again, per capita. So it's per person, not per working person, not per household. $90,000 per man, woman, and child that lives there. Down in Poppleton, that per capita income is less than $9,000, which is just extraordinarily low. One of the very interesting things to watch for with Poppleton is that the city of Baltimore has approved a TIF project there, so tax increment financing. This is the same method of financing Port Covington. And there's going to be some luxury apartments that will be built in Poppleton. And I think the really interesting thing to watch for is, does this actually lift residents of that neighborhood up out of poverty, or instead are we displacing people and having people that are living in Poppleton just have to move to another census tract? I think that's something that is very important to consider as we're thinking about solutions. And again, the life expectancy here, almost a 25-year difference between Worthington Ridge and Poppleton, just a few miles away. And this is a story that we see again and again within Baltimore, the Baltimore region. The kind of issues with suburbs and the city, this kind of duality is not really unique to Baltimore City. So you can kind of see this if you zoom in on the DC suburbs as well. So for those of you that know DC, we didn't calculate everything for the district here. But you can see that in the kind of northwest area of DC, a lot of that wealth is kind of bleeding out into Montgomery County. And a lot of the lower outcomes that we see in sort of the Anacostia region in DC and northeast DC are similar to the relationship between Baltimore City and Baltimore County, moving out towards Prince George's. Of note, we have Amazon's HQ2 is going to be built in Crystal City, Virginia, which is kind of right in, equidistant between the dark green and the more orangey red areas of the state. And I think the interesting thing to watch for here, again, similar to Poppleton, does having a major new anchor institution come in that's providing a lot of high-paying jobs, does this serve to help lift people out of poverty and out of these lower outcomes that we're seeing? Or are we going to end up just displacing people? And so it's a very real conversation that I think stakeholders need to be having, which is how do we make sure that everybody can kind of share in the gains that we're seeing as large employers come in? But to kind of think about just a few areas of the DC suburbs, we have Westmoreland Hills, which is in Bethesda, Maryland, which has an almost perfect HDI score. It's 0.9995. It is obviously the highest HDI score in the state. And not very far away from that, you have Langley Park, with a much lower HDI score. It would be essentially the equivalent of moving between Norway and Turkmenistan. Again, I do kind of want to highlight that the University of Maryland College Park is there. Towson is not alone. There are other colleges and universities with lower outcomes in their census tracts, and that's really, again, just a reflection of the populations that are there. So you really can't draw too many conclusions from just one tract level, but at the broader pattern level, we're seeing a lot of findings here that follow through. Thinking about per capita income, this is, I think, one of the most startling things about the DC suburbs is that the per capita income in Westmoreland Hills there is over $100,000 versus about $15,000 in Langley Park. And you might look at that $104,000 figure and say that is an enormous amount of money per capita per man, woman, and child, but it is not the highest. If you go just a little bit north, you get to Chevy Chase, where the per capita income is $155,000, which is obviously very, very high. Moving to the Eastern Shore, you don't see some of the same levels of difference that you do within Baltimore City or within the Prince George's County, Montgomery County area. You'd see kind of more of a pretty typical similar color and similar pattern of development, except for right in that middle of the Eastern Shore. You see a more heavily concentrated area of green there. And the reason for that is very much the Bay Bridge. So many of you, if you're working in economic development or you're reading reports, you'll see that a lot of places that introduce the greater Baltimore region also focus in on Queens County or Queen Anne's County, because a lot of people that live there will commute over the Bay Bridge, go work in Annapolis, Baltimore, DC. It's a long drive. I would not want to do it, but people do, and that's kind of the reason that we see these outcomes. Again, to put this into perspective, you have kind of Easton Unionville, which has a fairly high HDI of 0.931, versus areas in Salisbury, not the city as a whole, but just kind of one census tract there, that have much lower outcomes. It's essentially the same as moving between the Netherlands and Jordan. So again, you're not driving very far. This is not a long distance, and the outcomes that people have in these two areas of this region are very, very different. And then again for Western Maryland, it's kind of similar patterns as you see for the Eastern Shore, similar levels of development in both rural areas, both kind of the more mountainous western area as opposed to the more flat, low-lying Eastern Shore. We do see Deep Creek Lake, as I mentioned earlier, the home to a lot of retirees, a lot of people with their second home, and a thriving tourism business has the highest outcomes in the region. And then you have parts of Hagerstown that have much, much lower Human Development Index scores. Kind of along the line of thinking about, and I mentioned earlier, there are prisons that have the really, really low HDI scores. You can see one right below Hagerstown, which is that really, really bright red that kind of jumps off the screen at you. Again, to put this into a country perspective, it's the equivalent of moving between Greece and St. Vincent, which is an island out in the Caribbean. And so we have a lot of issues at the city level, at the neighborhood level, the county level, and really what we want to do, I think all of us kind of coming in here today knew anecdotally that there were a lot of issues and that there are a lot of problems. And I think one of the things we want to do is move towards identifying solutions. And so we did here at RESI a cluster analysis because what we wanted to see is, are the solutions that are going to work in Baltimore City the solutions that are going to work out in the Eastern Shore and out in Western Maryland? And so what a cluster analysis does is just a statistical technique that groups similar census tracts together and identifies different patterns. And we looked at the bottom third of census tracts, so the bottom about 450 or so 490. And I think one of the really interesting things that jumped out at us is that as we did this, when you're doing a cluster analysis, you do kind of to start off with a whole bunch of different techniques and use different variables to try and figure out how many clusters there are. And every single time we tried something new, we came back with just, the numbers kind of screaming at us as numbers do, that there were only 2 clusters to really focus on with regards to the bottom third. And so those are one, we're calling it the urban core. So this is about 119 different census tracts. It's not just in Baltimore City, but about 90% of the census tracts that are in this cluster are in Baltimore City. There other census tracts are in Hagerstown and Cumberland, in other more urban areas. And then you have cluster 2, which is wider Maryland, which is the 330 or so census tracts that make up the rest of the bottom third. And again, we tried really hard to try and split this cluster up into something different, and it did not come out that way. And I think that's really interesting, and we can talk about that and why that is. One reason, however, that I think that no matter what data we put in, that you do see a lot of the split between Baltimore and wider Maryland is that, as we've talked about in many of our other kind of discussions and webinars, you have these legacy of policies in Baltimore City that really create issues that are unique to Baltimore. So we did not use race or urban and rural as anything that we use to cluster, but just kind of want to walk through these 2 graphs here and what they mean. So this is the correlation between the Human Development Index score in a census tract and the percent of residents in that census tract that are Black or African American. And within Baltimore City, there is, as I think many of you will know, especially if you've heard me talk about this, there are issues with redlining that have left these deep scars within Baltimore City. There was blockbusting where developers would go and kind of encourage white flight and have people move out of neighborhoods. You have more racist housing covenants that you'll see in suburban areas, including just down the road here from Towson a little bit. And these policies really kind of split the city apart. And I think the reason that we're seeing Baltimore City emerge as this very distinct and unique cluster is because there are issues and there are legacies that have been in place in Baltimore City for hundreds of years. And so we kind of need to pay special attention to the city when we're thinking about solutions, how we're going to allocate resources. You do see this same pattern across Maryland, just at a lesser scale. So there is a slight negative relationship there between HDI and race for the broader Maryland. It's not that racism is not an issue outside of Baltimore City by any means. There is definitely a relationship there, but it is not to the extent that it exists within Baltimore City. And so one of the reasons that these 2 clusters are very different, one of the ways that they're different, I think it really has to come down to access to a car. And so households in the urban core and that more Baltimore City focused cluster, but also Hagerstown, Salisbury, only about 57.7% of households in those census tracts have access to a car, compared to, on average, about 88 to 91% of households in census tracts in the other cluster, as well as statewide. And this is very critical because, obviously, as I think many of us would presume, the lack of vehicle access is really strongly correlated with high unemployment, which makes sense. If you cannot get to your job, how are you going to hold a job? If you have to rely on a public transportation system and there might not be a public transportation system out where you live, how are you going to be able to get there, to hold down that wage and support your family? And this is really important because high unemployment is also very strongly correlated with lower HDI outcomes. And I think one thing that I do want to highlight with this graph, as we think about the relationship between unemployment and lower Human Development Index outcomes, is if you look at if you were to draw a vertical line about, say 0.85, which is just a little bit below the Maryland average, and you were to just look at the census tracts that are to the right-hand side of that line, what you would see is that there is a relationship between unemployment and the Human Development Index score for that tract, but it's not a very strong one. Whereas if you look to the left of that line, about 0.85 to the left, you'll see there's a very strong negative correlation there. So what you're seeing is that really for census tracts that have low outcomes, one of the most important things you can do to kind of increase the per capita income, the life expectancy that someone might have, is really to help provide jobs to that region. Once you get to around the statewide average, that's still a path you can take, but it's not as effective necessarily. And so I do want to give a shout out to one of our upcoming panelists, Martin Schwartz, who's going to be here talking about vehicles for change. I don't want to steal all of his thunder because I'm sure he's going to want to talk a lot about many of these things, but there are groups that are working on providing access to the resources that are missing statewide. This is definitely one of the very, very critical nonprofits that we really want to highlight because that path forward is so critical. I also want to talk just a little bit, speaking of resources, about computer ownership. This pattern is also the same if we're thinking about access to internet, whether that's broadband and high-speed internet, or if that's slow dial-up internet as well. But we see that census tracts within the urban core have lower access to computers relative to households that are in the wider Maryland cluster. And those households in all of the bottom third census tracts for HDI all have lower rates of computer ownership than the statewide level. That said, it really is that households across Maryland really do struggle with computer ownership. So you can see that this map tracks very closely to the Human Development Index score, outcome map. Areas in green are those areas that have rates of computer ownership that are higher than the Maryland average, and those that are in red are below. Another thing I want to highlight here is looking at health. So it's not just income, but health is one of the three components of the Human Development Index. And so when we think about health, one of the things we think about is access to healthy food. And so food deserts are really, really common in low HDI areas. They do exist statewide, but within Baltimore City and the other areas that are in that urban core cluster, the rate of food desert prevalence is double that statewide. And the rate within the broader Maryland cluster is also about higher than by about 50% or so. This is an issue. If you look at where food deserts are kind of on a map, you'll see that it's not just limited to urban areas or rural areas or the suburbs or not. It's really scattered all over. And so I also want to give a shout out to two more of our panelists from the Baltimore Hunger League Project and from the Family League. Again, I won't steal all of their thunder because they're doing incredible work and I want to let them talk about it. But I do want to note that the access to healthy food, especially for children across our state, is a huge issue. And there are a lot of nonprofits that are working hard on this. There are also government programs as well. But please feel free to connect with our panelists if you would like to learn how you can help. So now I kind of want to move and transition to thinking about solutions. We've kind of talked about some of the nonprofits that are working to address access to resources. But there are also different ways that, especially for the wider Maryland cluster, which is scattered all across the state, how do we bring people in? And so one way is, as many of you may be aware, there's a federal program for opportunity zones, which are census tracts that were identified as more low-income areas, where if a business comes in, they make a long-term investment, I think it's over 7 years, then they receive some tax incentives, which is great. The idea then that you have more businesses in an area, which can help provide employment opportunities to the local population and help lift people out of poverty. In Maryland, there are 150 census tracts that are designated as an opportunity zone. And as you can see, they are scattered all across the state. So they're in the DC suburbs, they're in Baltimore City, they're out in Western Maryland, Eastern Maryland. The really, I think, really good way that Maryland handled picking opportunity zones is that they tried to spread them out so that as businesses move in, hopefully there's not one area of the state that's really missing out on those new investments. And want to highlight and relate this back to HDI. About 70% or so of the opportunity zones are in the census tracts that are in the bottom third. The rest of those, the other 31.5% of the opportunity zones, are located in nearby areas. It's not that there is an opportunity zone in Roland Park, but they are also, again, spreading out some of that need, especially given the fact that the bottom third of census tracts are so heavily concentrated in some of the more urban areas. And so another approach that I just kind of want to briefly touch on before wrapping up would be placemaking. So, you kind of have, I think a lot of us are familiar with, supply side, demand side economics. So when we're thinking about ways to increase economic activity, you have kind of a more traditional business-focused approach in opportunity zones, and then there's also more of the demand side approach in placemaking. And so for those of you that aren't necessarily aware, placemaking is the idea that, kind of if you make an area really, really attractive for residents, if you increase the quality of life, if you increase the walkability, the public transit that they can get to, you'll have more people move into that area. And then as people move in, some of them will start businesses. Businesses will be attracted to the region because businesses want areas where people are. And I think one really good example of this is thinking about in the long scale, kind of the downtown revitalization of Frederick. You've got these nice canals you can kind of walk along. There's really nice bustling downtown. And so it's thinking about, how do we apply some of those same strategies to other smaller urban areas across the state? Because as one of the very first slides that I showed went over, I think it was only about a 0.5 percentage point or so of the job growth over the last 10 years nationwide has been in more micropolitan areas. So to wrap up, just kind of at a high level for the conclusion, there are local variations that exist in our outcomes across the state. This doesn't just happen at the county level. There are variations within the counties. But the reasons for those variations are not the same. So the reasons that we see lower outcomes in Baltimore City are not the same reasons that we see lower outcomes in Frederick County or in Hagerstown. And really, I think one of the big things to think about here, and it kind of correlates with the causes a little bit, is the emphasis on unemployment. Unemployment is a huge driver of HDI and low outcomes, and the causes for unemployment are a little bit different. So within Baltimore City, you have access to existing jobs. Baltimore City and the greater Baltimore area has a ton of jobs. It is the economic driver of the state, depending on who you ask. I would argue that. And it's this really, really great place. But you have people that can't necessarily get to jobs because they don't have access to a car. The public transportation system may be unreliable. And then you have areas of the state where there's high unemployment levels, but that's really tied to the fact that there just need to be more businesses coming into that region. It's not that you can't get to the job, it's that the job doesn't necessarily exist. And so thinking about with opportunity zones, how can we bring more businesses in? With placemaking, how can we kind of try and encourage that to be a little bit more spontaneous and community driven? Also want to, again, re-emphasize the resource needs. These are relatively tangible things that we as community, as policymakers can help to implement. And then finally, I want to close with the idea that these are all really, really complicated problems, and they're going to require the efforts of everybody in this room. And so to that end, we here at RESI are going to try something a little bit different, which is after this session and after we have the really great panel discussion, what we want to do is we want to keep this conversation going. And we want to hear from everybody here in this room, as well as any of your colleagues or partners that you think would have some really great insights. And over the summer and fall, what we're going to do is launch a series of kind of roundtable discussions. And so they're going to be centered on things such as education, community involvement, public transportation access. We want to bring people that are really passionate about these issues, that are working on these issues together to talk about what they're doing, what the problems are that they've specifically identified, what we can do to make a difference in Maryland, what are some success stories that we can latch on. And then what we're going to do at RESI is kind of pull together everybody's thoughts, do a lot of research, which is what we do, find some data that helps contextualize some of the issues, and then publish a series of white papers that will then, using our network and our resources, put in the hands of policymakers statewide to try and drive your solutions and your ideas and to bring those out for policymakers all across the state. And hopefully in the coming legislative session, we'll see some of those same ideas get enacted. So with that, please, if you're interested at all in participating in that, send me an email. I'd love to hear from everybody here to find out what your ideas are. This is not something that we can do here at Towson on our own. And so with that, I'd like to ask if anybody has any questions, and more than happy to answer anything.
Canada. This relates to transportation, and that they're basically hiring contracting with a firm for a bus service rather than having their own municipal bus service. And it's like an Uber bus system. And residents would be given vouchers to be able to use, and the bus will pick them up, take them to their employment. I'm just curious if you've seen or if you're going to be diving into any of this in the state of Maryland, and if anybody else is looking at using Uber as an individual, because that also creates another job, in addition to getting the person to the job, or a mass transit system.
Yeah, that's really interesting. I hadn't heard specifically about that. I do know I was reading an article in the Baltimore Business Journal yesterday, I believe, that South Baltimore Partnership is proposing kind of a $2 flat fee area for Lyft rides, which would hopefully connect people in more traditionally disadvantaged areas with their job. Kind of sounds somewhat similar, not necessarily a bus service, but trying to kind of fill that gap. Obviously, I think public transportation is one of the biggest issues when we're thinking about how we're going to connect people with jobs and to lead to better outcomes. I think for smaller areas, the challenge with public transportation is definitely budget. Nobody goes into, creates a public transportation system thinking they're going to get rich. I don't think that that's ever how that really works out. I think sometimes the worry with having private suppliers of public transportation, though, could be, finding out who they would serve. And I think that's definitely just an important consideration. But if you have any information on that or have the article, I would love to read that and find out more. So for the next stage of the Outlook Forum, what I'd like to do is call up our panelists and our moderators. So moderating the next piece of this will be Dr. Darius Arani. You met him earlier. He's the Vice President for Strategic Partnerships and Applied Research here at Towson. I'd also like to welcome Alicia Azeltine from Towson University, Linny Kahn from the Baltimore Hunger Project, Terrace King from the Family League of Baltimore, and Marty Schwartz from Vehicles for Change.
We sort of purposely picked individuals in these areas who are providers, solution providers to many of the challenges facing our state in sort of getting people to work, feeding people, as well as sort of addressing some issues around returning citizens in our state. So I'm going to throw it out. I'm going to start with Alicia and then kind of work down the line and finish up with Marty. So that, now that you've heard the challenges facing the state, can you please maybe provide a brief background on the work you're doing, your organization, and how it is helping address the challenges facing many communities in Maryland? Alicia.
So thank you all for coming. I appreciate this opportunity. I want to give a little bit of background first before I talk about what I'm working on. My area of interest is mass incarceration and the consequences of criminal records for returning citizens, so people that are returning to their communities from prison. And I think that the slides earlier, the presentation that Michael gave is fascinating. It would be really interesting to see how that maps with our processes of mass incarceration in the state of Maryland. There's a growing body of research that talks about how mass incarceration is actually a major contributor to inequality and social stratification. And for so long, we've been thinking of mass incarceration as a solution to social problems, but it actually perpetuates many of the issues that Michael was highlighting. So maybe in the future that might be something to explore. I know Maryland is one of the few states that actually tracks in our census data where people come from who are incarcerated, so we can see some of those patterns. And I want to talk a little bit about my initiative. So I'm a faculty member, that's my day job. That's how I pay the bills. But recently, President Schatzel, pretty soon after joining Towson University, created the B2 Partnerships for Greater Baltimore, which was a wonderful opportunity for folks on campus to explore and develop some of the relationships that they have already had with community groups and really to support those relationships. So I've been doing a lot of work in jails and prisons and with returning citizens, higher education in prison. So my focus isn't an organization per se, although I do claim Towson, of course. But it's really about getting the conversation started on campus about how we can support returning citizens in terms of higher education. And also contributing to conversations in the greater community about how we can support the returning citizens in those venues. So it's just one element to get the education that you need, but then when you're trying to get the job that has, that you've been training for in terms of your educational experiences, there are all kinds of barriers in terms of professional licensing, background checks, all those kinds of things. So that's really my kind of bread and butter in the conversation that I'm hoping to bring to the panel today.
Hi, thanks for having me. My name is Linny Khan, and I am the founder and director of Baltimore Hunger Project. Baltimore Hunger Project is an organization that's dedicated to eliminating weekend childhood hunger. Childhood hunger is, specifically over the weekends, is something that most people don't think about. Kids come to school Monday through Friday and receive free breakfast and lunch, and then they go home on the weekends, and that Friday afternoon to Monday morning, oftentimes there is not enough food or any food really for them to eat over the weekend. Studies show kids who don't eat over the weekend, it takes them until Wednesday till they can focus on their studies in school. And hunger also affects their cognitive ability, their behavior in the classroom, their attendance. And what we are trying to do is help bridge that gap over the weekend and make sure that they come to school ready to learn. We are currently in our 4th year, and we support 472 children every Friday with a weekend bag full of food. We are hoping to be at 600 children in September. We have over 1,200 kids on our wait list. To your study, which I found fascinating, right now we're in Baltimore County, and 44% of the kids who go to Baltimore County public schools qualify for free and reduced meals. So the need is tremendous, and it's not just a problem that is in the city, it's a problem that is statewide, and we are working to combat that. So I thank you for the opportunity to be here.
Terrence King, great to be here. I really appreciate the opportunity. Today I'm here representing Family League, and I want to say to our president, I am a 2-time alumni, 2-time graduate of Towson University. And in fact, this December, as part of what I'm doing with Family League, my studies has really been in this area, about finding the assets and communities to really collaborate and work with to make the kind of improvements necessary in our city. So let me give a little bit on local management boards. So around the same time HDI occurred, I see early 1990s, local management boards came up across the country. And those boards were set up for the purpose of giving greater autonomy and authority to local leaders in terms of being able to look at the priorities and needs within your local municipalities and matching that with the funds and targeting those funds to those needs. Because before it was on a broader basis, and funds weren't really going where the need was really indicated. So Family League is that entity for Baltimore City. So within Baltimore City, Family League gives out grants throughout the year at about $20 million a year to over 70 grantees during the course of the year. And we're really a data-driven organization, and this has been the key for me in kind of turning this organization. As retired deputy CIO of Medicare and Medicaid, my issue has really been, how are we going to do this in a quantifiable way? And let's have the kind of infrastructure that can go back and look at the progress of what we're doing among our grantees. We track the progress being made, we monitor the progress, and where there are difficulties, we work with those individuals to increase their capacity in certain areas. But lastly, we are the hub in the center of issues within Baltimore. Because whenever there's an issue that crosses service lines, Family League is that entity that is about collaboration. I'll stop, but let me say we have two big flagship initiatives. We have a number of initiatives, but it's two big flagship initiatives. One has to do with improving infant mortality in Baltimore, called Be More Healthy Babies. And so that's a critical piece that has really been able to improve by 30% from that year in 2009, where over 128 babies died during the course of a year because of the issues that their mothers had and those infants had in terms of a premature birth. And so we've been able to turn that around, and I take with great pride that over 50 babies are alive today directly related to the work the Family League is doing in sending gynecologists in, midwives in, nurses in, whatever our team assesses that mother needs. So that's a critical piece. The other piece on education, community schools. We have over 45 schools, 20,000 kids that are part of community schools, where we pay for a team, a coordinator, there's leader in terms of community, the school lead. The part that really matches with what was said about meals, we have after school care folks as a part of our team as well, and we make sure that kids are fed and we're connecting what nutrition has to do with academic success. So those are the flagship pieces, but there are a number of initiatives among the 70 that I mentioned that Family League is also involved in. Whatever the problem is in Baltimore, in a major way, I get a call about it. Whether it's a kid hitting a police officer who receives services from a number of folks, or what are we gonna do about the squeegee kids on the corners of Baltimore City, my phone will ring over those issues, because we're that collaborative body that brings the forces together to make a change.
Thank you, Terrence. Marty?
Sure. I don't think I have to say much since Mr. Sears gave us a
Stole his thunder.
So I'm Marty Schwartz. I'm president and founder of Vehicles for Change. We've been here in Baltimore for 20 years. We actually take donated cars and we repair them, and then we identify families who need a car to get to and from employment to escape poverty. As you saw from the slides, there are many, many more families that need a car than we're able to provide a car. Back in 1999, when I started Vehicles for Change, transportation was identified as the #1 barrier to employment for low-income families. Unfortunately, today, transportation is still identified as the #1 barrier to employment for low-income families, along with child care. There are, the Brookings Institute did a study several years ago of major metropolitan areas and the number of low-income households without a car and without access to public transportation to get to employment. The number in Baltimore metropolitan area is 60,000 households. Not people, 60,000 households. It's not only a human issue, it's an economic issue. And so Vehicles for Change has actually been more involved recently in looking at how do we solve this transportation issue beyond cars? We're not going to provide 60,000 cars. If we did, all of you would be calling us saying, wait a minute, you just put 60,000 more cars on the roads. I can't get where I'm going. And actually the idea in the article in the Baltimore Business Journal, although it didn't mention Vehicles for Change, was our idea. We met with Lyft and with the folks in South Baltimore and talk to them about how do we provide a low-cost transportation system that can get people individually to and from their jobs. So we really do have to find the answer to this question. Very often, if you're a single mom with several small children, there really isn't an opportunity on public transportation to access life, if you will, right? You can't get to childcare because public transportation isn't going to get your children to the childcare, back to public transportation, and back to your employment. You can't get to food stores, right? Yeah, there's food deserts, but a big reason there's food deserts, we wouldn't have that problem if people had access to transportation that could get them to a quality grocery store. So, you know, we're looking at this issue. We've been awarding cars throughout the state of Maryland, actually Virginia and Michigan. We're the largest low-income car ownership program in the country. We've awarded over 6,400 cars to families. And as you can guess, based on the slides and the information, you know, a car makes an enormous difference. 75% of the folks who get a car from us within the first 12 months of car ownership increase their annual salary by $7,000 a year. That's a big number, but it's just because they don't have access. Besides having access to the job, those are the families who get cars from us who have children are taking their children to after-school activities, to recreation and athletic activities, and to cultural activities that they can never get to prior to that. So an automobile not only impacts current poverty, it impacts generational poverty. It increases access to education, to food, to doctors, to all of those things that impact generational poverty. Just besides, you know, obviously providing cars, in the process of repairing the vehicles, we train individuals coming out of incarceration to be auto mechanics. So we've been doing that for the last 4 years. We've trained over 115 individuals right now through the current time. And clearly, a job is the #1 factor in recidivism. We have a 100% placement rate. The jobs in the automotive field are plentiful and pay a great salary. Over that time period, we've had 1 individual go back to prison. We have 3 individuals who make over $100,000 a year. So a job makes a huge impact, and we have to find a way not only to get people to work, but we have to find a way to provide opportunities for individuals coming out of incarceration to have access to a better lifestyle.
So thank you. So looking at the presentation, you see that, you know, we have a heavy concentration of low HDI in Baltimore City, but we have it spread across the state in the wider Maryland. So, you know, can you comment on how your solutions might be provisioned to more rural communities? Go ahead.
So I think that the solutions, especially when thinking about returning citizens, are going to have to be much larger than just thinking about Baltimore City, Baltimore County, et cetera. So many of the barriers are going to have to be legislative. I'm happy to be in Maryland, where we just passed, the legislature passed legislation that banned the box essentially in college applications. So we're in the first year of that policy change, and that's going to be huge in terms of opening access. I think even just having the question on college examinations or applications reduces applying to college by 22%. So that'll open up some doors for folks in terms of opportunities. If we can do the same kinds of things through your various professional organizations, opening opportunities in terms of licensing or thinking more deliberately about hiring practices and how you're going to treat criminal records and those kinds of things. So I think, at least in this particular area, the solutions are going to be much broader than thinking just kind of rural in Baltimore City, even though we know that mass incarceration really is impacting Baltimore City, Baltimore County, Prince George's County. Those are the major kind of feeders to our prisons. But many people are coming from all over the state. So absolutely, it's scalable. What I'm hoping, and through BTU support, is that Towson University really becomes a model for how universities can contribute to these conversations and thinking more deliberately, not just in terms about of admitting returning citizens, but thinking about our own hiring practices, our own relationships with the business community, and encouraging different kinds of thinking with our corporate partners, with our nonprofit partners. But thinking of Towson University as not just in many senses kind of a city in and of itself, and how we can think about different practices kind of at all levels of our university and really be a model for some of the other universities in the state. California is doing amazing things, and I want Towson University to be kind of the model for the East Coast, is my vision. So absolutely, I think it's scalable, and it has to be. It's the reality. It has to be beyond Towson University and just the Baltimore region.
So I feel that in order for us to expand and to be more scalable, it's really creating the awareness. I think the weekend component of hunger is something that people don't talk about. I think it's something that we don't even consider it. And that really is the first piece for us. Like I said, we have 1,200 kids on our wait list. There are thousands of kids who could benefit from our services. And I think the way we do it is by partnering with organizations like the Family League, or in other counties. I've had meetings in Howard County trying to figure out how to expand our program and bring it into their school system. And maybe finding a way to see what schools have. Lots of schools have food pantries, and lots of churches and different organizations work with schools, but there's no real, what the word I'm looking for, but there's no real bank of that information. And I think in order for us to continue to grow, perhaps that's one way to coordinate our efforts.
Okay.
There's a couple areas that I really want to look at, and I've talked to staff and leadership quite a bit at Family League, and I don't want to jump to how do we grow our initiatives in terms of scalability before I deal with the issue that I really think will be of benefit to others throughout the state that are grappling with similar problems. If we build quantifiable models, if we first build models that can be replicated. So my first issue is what we are doing. I want it to be more than feel-good exercises. I want us to do more than just gather people in a room. I want us to do more than have movements that touch individuals' emotion. Baltimore City is in dire need of real change and methodologies that are documented so they can be replicated. And that's the critical piece in taking on chairmanship at the same time that I was going through dissertation here with Janet Delaney that I took to the greatest extent of importance. So we can build a model in Cecil County or on Eastern Shore. They can use those models to say, what does community schools do beyond serve 20,000 kids and bring panels of 5 people apiece to run that school? I want to be able to say, here's the academic achievement and the methodology used that has caused that, and now you have a similar situation in another place, and you can work that model. And that's the data-driven piece that we're still struggling with. And so that's where I want to go in terms of scalability. Another piece is what was mentioned with the report, the regionalization issue. The problems of Baltimore City are the problems of Randallstown and Owings Mills and Pikesville. And until we're able to make those connections in terms of scalability with the leaders in those areas and move our initiatives to other areas that are quickly being impacted by the same kind of issues we are in the heartbeat of Baltimore, that's when we gain political strength. And the political piece is extremely important in terms of not the competitiveness, but the power that's needed to really make a change. And so that is another, it's not just how we grow what we're doing, it's how we gain the wings through resources and funding and evidence-based processes that will make us ready to be scaled, and we're not ready for that yet.
Marty?
Yeah, so, I mean, when you're talking about rural areas, you know, the transportation issue really becomes more and more devastating the further out into rural areas you become, right? Because if you live in the city, there are some options, right? I mean, we do have hacks in the city. We have taxi cabs, we have Lyft, we have Uber. Sometimes they're not economically viable, but I think we can come up with solutions in the city because of the amount of population. But when you get out to Hagerstown and to Cumberland, and we've been operating on the Eastern Shore for a long, long time, all of a sudden, you know, a job is not 2 or 3 or 4 miles away, it's 15, 20, 25 miles away. You know, daycare is 5 or 6 miles away, and there is zero public transportation. And to make a program like a Lyft rideshare program economically feasible for somebody who's making $8, $9, $10, $11 an hour, it's virtually impossible in rural areas. So from a transportation standpoint, it's really important for Vehicles for Change and for car programs to be available for individuals so that they can really access the opportunities that those of us who have a car or those individuals who live in the city who have access to public transportation can access, but you just can't do it. I mean, most of the folks that we work with on the shore in Wicomico and Somerset and those counties are trying to get down to Ocean City to get jobs. As we all know that have been down there, there's no way to get from Salisbury to Ocean City. There's very few jobs in that rural area. So the transportation issue becomes much more acute when you get out to the rural areas as opposed to the urban center of the state.
Thank you. I know that Terrace touched on his barriers to sort of challenges he's facing, which is sort of a good data-driven. Any of you would care to comment on some of the challenges you face sort of to be able to scale up?
Our biggest challenge is cars. So if y'all have a car, we'd love to have it. But you know, we face that situation again. The demand for an automobile is way beyond the number of people that we can provide cars to right now. And so, you know, we've faced that issue for years. We're actually working with the state right now to see if we can get some of the state vehicles donated. We're working with the city to see there's a large number of cars that are impounded in Baltimore City every single day that are sold at auction, that if we can get access to those vehicles, we can get people back to work. So, you know, that's a huge challenge for us in the transportation side. You know, on the training side and working with individuals in incarceration, the biggest challenge is overcoming the fear of hiring somebody with a criminal background. It's amazing, and I might be stealing some of your thunder, but you know, we've been working with individuals coming out of incarceration. I'm talking about our average individual was incarcerated for 13 years. 13 years. You know, they were incarcerated, started getting incarcerated, involved with the criminal justice system at 15, 16 years old. You know, how many of us made bad decisions when we were 15, 16 years old, right? You know, maybe we didn't get caught, right? And that's probably why we're here and we don't have a criminal background, or there's some other issues there, right, of growing up in the city and being an individual of color. But now you're coming out and you've lived in a prison for 15, 16 years, and now we have employers that are scared to death to hire somebody because they think that person hasn't changed. Well, I got to tell you, how many of us has changed over the last 15, 16, 17 years? We're not the same person we were when we were 16, 17, 18 years old. For me, it was a whole lot longer than 13 years ago. But you know, what we need to do is we need to get to employers and we need to convince employers that these are high-quality individuals, that they have changed, that they've gone through programs. And I'm not saying everyone, right? But there are individuals that are coming out of incarceration right now, and I can tell you of the 110 110 guys, 115 guys that have come, men and women that have come through our program. I've hired several of them. Mile One has hired many of them, one of our biggest employers in the state of Maryland, one of the largest dealerships in conglomerates in the country, and they're hiring individuals with a criminal background. There's got to be something there, and there are plentiful jobs. I actually sit on the Governor's Workforce Investment Board, and thank you, Mike, for sponsoring this event. And there are way more jobs that are available in the state of Maryland that are open right now than we have. We have plenty of people that could fill those jobs, people that are coming out of incarceration, people that need transportation, and we can get people to those jobs. We just have to open some people's minds about how they look at individuals who are either coming out of welfare or coming out of incarceration.
And I'd like to add, if you
Please.
don't mind. Okay, so I think that the stigma of having a criminal record is probably, as Marty mentioned, one of the biggest barriers. And we tend to get into traps when we're thinking, especially as advocates for better supporting returning citizens, where we get into these traps where we start parsing out who's worth our resources and our investment. So we think about past crime, or we think about the other people that we imagine might not be served if we don't share the resource, the good people, so to speak. And I think thinking about language and kind of retaking the narrative away from this idea of the kind of the good folks and the bad folks would make a big difference in terms of reducing some of these challenges, which are mostly fear-based and not based on much of reality in many cases. So using terms like returning citizens and really emphasizing the shared humanity, right, with people that we've long imagined to be, not part of our communities. If we could even just get through that, that would make a world of difference, I think, in terms of people wanting to open opportunities and share resources with people that we've long denied those resources.
So I think for us, it really comes down to dollars. I mean, like I said before, there are thousands of kids who could use our support, and it comes down to being able to fund it. I know each one of our weekend food bags costs $5. I have two children, and I often go to Starbucks with my daughter, and she'll get a Frappuccino and a cake pop, and she's pretty happy, and I tell her that's the same price as what it cost me to buy and put together a bag of food for kids. It's $250 for us to support one child for the school year. And so I think the more money we have, the more children we can support. And I guess one other piece I would say is it's not a competition with different organizations that are feeding kids. And I think if we all look at it that we're working together and we're not overlapping each other's efforts, I think that would help us work better together and help us take on more of the problem.
So a couple areas. I did mention the data piece earlier, but I think there are a couple other pieces. I think we need another impediment, more researchers. Of course, I agree with you in terms of money. The money that we receive, the vast majority of the money is about $800,000. Less than 5% of the money we receive is government money. Everything else is government. $800,000 from philanthropic organizations and foundations. And so the reason that that's important is the government money we receive restricts us in terms of innovation, evaluation, and really being able to do the data-driven things that we'd like to do, because there's certain requirements around that money. So the only entity that gives us above $5 million is Baltimore City. So we have state and Fed money that comes through us as well as pass-through. So there's restrictions there. So money is a critical issue, but we also need, let me get this in real quickly, is capacity building. Now, not just for us. So there are a number of trusted sources in Baltimore City that could really make an impact in communities, but they don't qualify for our grants. And many times they don't qualify because they don't have the administrative skills or the financial wherewithal to be able to do the things necessary, whether it's from a payroll or an HR perspective, to be what we would think of as a legitimate organization to qualify for our grants. We cannot lower our standards. So we need folks to work with us in terms of capacity building, and that is critical because we've been able to turn under my leadership to giving money to more of the community organizations, because this is really critical. In Baltimore City, having outsiders come in who many times want to treat the citizens of Baltimore in a paternal way is an issue. We need organizations within Baltimore City who look like the people they are serving, and many times to be who's on the front lines. But unfortunately, those folks don't have what it takes to make our grants. So I need someone to help me lift those organizations up because I want to give them the money. Because many times they will be more effective because they're trusted by the citizens in Baltimore in a greater way. And that's an important issue for us. We also need help in terms of our IT infrastructure so I can do the things that I'm talking about in terms of being able to really tabulate and quantify the methodology we're being able to use to say, is it working? What are we getting out of this $20 million that we're spending? And I want to be able to answer those questions definitively. And so those pieces are still keys to us. And there are individuals in this room, and it's not just about money, that I know could be extremely helpful in helping us make a dent in some of those impediments and challenges.
All right, before I throw this to the audience and give you guys a chance to think of some great questions, I'm going to let the panelists come up with any last comments before we throw it to Q&A. Is there any last words?
I think that this is a great discussion. I think that this issue, I know that Weinberg is doing some things in terms of their lab or whatever and looking at this issue with Robin Hood as well about what the key levers are that can be pulled or pushed in order to move folks through poverty. I think some connection between what they are doing would be critical. Being on the operational end, on the ground end, the thoughts are great when they I think link with folks who are doing the kind of operational things on a ground level that are being mentioned here. And I think that connection too often doesn't happen. So I appreciate this kind of dialogue, because being able to take kind of the study and the conceptual and see where things are and connect it with what's going on at a ground level is really, really important. And I appreciate the opportunity to be linked with what we're doing here today.
Any last words?
Yeah, I think one of the challenges that we have is as social, I hate the word nonprofit, because if you're not making a profit, you're not going to be in business next month. But as a socially driven organization, one of the things that we end up doing is we come to an event like this, right, and we talk and we interact, and then we all go back and we have to get back to our day-to-day, and everybody's working in individual silos, and there's so much great work going on that it's really important, more so than anything, that nonprofits collaborate together and try to solve issues in a teamwork kind of manner, right? We're lucky because we're able to work with, we work with probably 75 or 80 nonprofits, because to get a car from us, you have to come from a partner agency. So we work with Center for Urban Families, and we work with Living Classrooms, and we work with all those organizations very closely because it made sense instead of us doing what they do. And so I think it's important, as you start to look at these issues, is how do you connect the organizations that are doing great things and help build those organizations up, and get them to work together so that we can solve these issues, because these issues, and we have to think of these issues in a variety of ways, because we can't just think about the human issue because there's not enough people out there that care. And that's unfortunate. But I can tell you this, everybody cares about our economy. One of the biggest barriers, and you got me started, Darius, I'm sorry, but one of the biggest barriers to getting a car is car insurance. Car insurance in Baltimore City can cost somebody as much as $3,600 a year. $3,600. But the only way we were able to get the state of Maryland to start to look at the car insurance rates for low-income families, because if you look at low-income families, they pay 20 to 40% more in Baltimore City than anyone else. The only way we get them to look at it is because on your insurance bill, you pay an uninsured driver insurance, right? Well, the people who are uninsured are people who can't afford it, but they have to find a way to get to work and survive, so they drive without insurance. It's an economic issue. It costs $44,000 a year to keep one person incarcerated in this state. Think about that. $44,000 a year. Now that alone should get us excited about doing something about recidivism. I can go on and on.
I know. Any last words?
Sure, I would say that hunger's invisible, and it's hard to tell who eats and who doesn't eat. And when you're a student and you're sitting in the classroom and you're focusing on your science or your math, and you're not worried about whether you ate dinner the night before or when you go home, if you're going to have something to eat, you're in a better place than perhaps your neighbor. And I think we all just have to be a little bit kinder to everyone else, because food insecurity doesn't mean that you always don't have access to food. It means you lack a consistent access to food. And so you could have a car and your car breaks down, and the money you would use for food is now being used to repair your car. And so I guess I would just say kindness goes a long way.
Melissa?
I think if you're interested in one of the components of the initiative I'm working on through BTU is developing a cadre basically of educational advocates or allies for folks that are coming out of prison and interested in pursuing higher education. So if you're interested in something like that, it would be wonderful to have people to help coach folks through the whole process of application, financial aid, in this maze of higher education. Also in terms of if you have folks in your agencies that are interested in higher education and have that experience, we're also happy to help support them through the process. And then just again, really encouraging you to, in your social circles and your professional networks, to start having the conversations around supporting returning citizens and hiring practices. Thank you.
All right, so now I can open the floor up to any questions any of the audience might have, or have all the answers have been provided by this panel, so there are no questions. So, yes.
Hello, good afternoon. I just want to start by saying thank you to everyone here. Thank you for sharing all the Thank you for sharing all the information. Thank you, Michael, for your speech, because I'm not the only one to say that the information presented was jarring and really, really shocking. I'm looking forward to getting the full slideshow presentation. I'm really looking forward to the panel and roundtable discussions that will come in the fall and the summer, and hopefully be able to talk to more of you after the event, because I do hope that we're able to further contextualize that it is not a coincidence that a lot of what is happening is in Black and brown communities in the state of Maryland. It's not a coincidence that the high rates of incarceration are in Baltimore City, Baltimore County, Prince George's County, and that a large percentage of African Americans that are employed in Baltimore City are in one of four areas. They are in healthcare, retail, administrative support, and transportation. And that if we are not working to solve the root cause of this, we are not working to break down the racial disparities that exist in Maryland and the country at large, we won't be able to. What good is it to go to all of the businesses that exist if they're not going to hire you? What good is it to worry about certain things if you can't even get in? I just wanted to add that.
Any other questions out there? Yes.
Thank you guys so much. This was an incredible panel. I really enjoyed listening to each one of you guys. It took everything in me to like not be back here screaming and shouting and clapping my hands. So I'm like containing myself here. So I'm very, very grateful for you. I did have one question. I know, Leslie, you mentioned the 22% rate of acceptance rates that you think will go up because of the ban the box that you've just implemented last year, and you even, and sidebar, I'm so grateful that you mentioned language and how we can change language from like inmate to like returning citizens and humanizing that experience. I think that goes a long way. So, you know, you stuck it in there, but I want to like pause for a minute and land there because that's very important, and I'm grateful for you saying that. Okay, now I'll get back to my actual question. Okay. The enrollment rate, do you guys have has Towson, have you guys thought about the ways that you're going to recruit for the future classes of these people that will now have access that they once, you know, have not had in the past? But now, how are you thinking about getting into the communities and letting people know, say, hey, you now can do this, and we have a pathway to help you ensure that you have a success path after prison?
Yeah, so there's a couple partnerships that we have, which many of you may be familiar with. Goucher's Prison Education Program. They have two prison education programs in Baltimore, in Jessup, in a men's facility and a women's facility. University of Baltimore now is also have a program that they'll be starting their third year. So we have great relationships with a lot of those students or those programs in terms of supporting those students to come to Towson. So I believe it was Terrace, or maybe, I'm sorry. Someone said not to think about competing with each other, right? And so these partnerships, especially with Goucher and University of Baltimore, aren't about who's gonna get more students, it's about what's gonna serve these folks the best, right? So there are instances where Goucher might be a better fit or University of Baltimore might be a better fit, but there's instances where Towson is gonna be a better fit. So thinking about the partners that are in kind of the landscape about how we can do the work in a meaningful way that doesn't become competitive is one of the ways. The next is also starting to work with our detention center partners. So we have great relationships with Harford County Detention Center, Baltimore County Detention Center, and we've just kind of gotten a new partner on board in East Baltimore. It's a federal reentry facility. So starting to think about where people are and how we can start having those conversations. One of the barriers, for example, is many people have started college before many might be an overstatement, but a number of people have started college before they went into prison. And they had student loans prior to going into prison. And then those student loans lapse and they come out. So there was one particular individual who had about $1,000 of student loans when she'd gone into prison, and she got out 9 years later and had about $9,000 in fees and all those kinds of things. So even starting those conversations with folks that are incarcerated now to help them get out of default so that they can make the transition into higher education if that's the path that they choose. So really thinking strategically about partnerships and having conversations like this. I just had a wonderful conversation with Lori about what her national and the local HR organizations might be able to do around these kinds of things. So it's really thinking in terms of partnerships, in terms of what the actual needs are. Recruitment, libraries are an amazing resource in Baltimore City, where especially this computer access issue, where a lot of people who are coming out of prison who don't have access to computers or the internet are going. So where are the people gonna be? And that's where we're gonna go, essentially.
Can I make a comment about the first, it wasn't a question, but a statement made around race? I think it was a very important comment. And it's an uncomfortable comment that I've had within Family League. So there's a couple things that we've done. I wanted to make sure that the lens we have on when looking at our issues within Baltimore and what policies we advocate, that we're wearing the right set of glasses when we look at it. I'm very comfortable with uncomfortable topics. And I'm not comfortable until I can feel the room is uncomfortable. Because I've learned that's how I push organizations forward. So we use now, after having gone through weeks of training, a racial economic equity analysis and toolkit in terms of how we look at everything we do. Understanding what the individuals in that community are confronted with and how to ensure that there's equal power in dealing with our stakeholders. Where we will put the preponderance of our resources in the future, we're carrying forward the analysis done by Lawrence Moore of the L in the butterfly and looking at Baltimore. Because we understand that in Baltimore, coinciding with what you showed, the vast majority of the resources spent in Baltimore are around that L from the Inner Harbor up through Hopkins' own territory. But the butterfly of North Avenue, Poplar Grove, and these other areas have been left out. And we're not going for that. We're going to put the resources where they need to go. And so the L in the butterfly is now driving where we really want to put our resources, because we do see race and racism, systemic racism, not accidental, as part of the reason that we find ourselves where we are organizationally throughout Baltimore City. So thank you for raising that point.
Yes.
Thank you all for your presentations. I was wondering, it sounded like a recurring theme across what everyone was saying, that this is really about raising the quality of life for people, community building, and also placemaking. That was a very interesting point. And when you spoke about capacity building, what came to mind for me was, do you find in the work that you're doing that you get support from the many stakeholders who need to be a part of the dialogue as far as the corporate environment, anchor institutions? And also, are there people who you don't have at the table? Who are some of the partners you would like to see become a part of the dialogue?
I mean, the partner, the reason I'm here today, let me say, and Brian, Bobby, they know, I want Towson at the table. I want this university at the table with me and helping to make some decisions. Philanthropically, corporate, no, we're not getting it. We need to have a better understanding of how to take the information that we do have and to craft whatever documents are necessary so that I, along with the CEO, Damon Millard, can go to the T. Rowe Prices or whomever and say, look, you want to make a difference? If you really want to make a difference and not just give a speech about it, Baltimore is the place. You don't have to travel to Ethiopia or some foreign land. This is the place. And with what we're faced with in Baltimore right now, this is the time. We're at an all-time low as a city. And certainly sitting in the middle of what's going on in Baltimore, as the local management board, we are the organization. But we don't have money coming from entities or the intellectual capital in the way of resources to help us make a dent. And we're at desperate straits. There are people living in Baltimore City who are afraid to come out of the door. This is not an intellectual conversation. This is real. And Family League is a part of that. When police commissioners start calling me about how to deal with squeegee kids, we got a problem. And yes, I'm here begging for help.
Anybody else?
Yeah, I mean, for our part, we're lucky that we do have a lot of the players at the table. You know, it's interesting. You talk to a lot of people and they talk about eradicating poverty and bringing families up, and they talk about education, they talk about training, and they talk about a lot of things, but they don't talk about transportation. You know, we're one of the few groups anywhere that are screaming about, you know, look, we can go down to Cherry Hill, we can go down to any of these neighborhoods in Baltimore, and we can give everybody a PhD, but guess what? None of them are going to work.
That's right.
Because they can't get there. And so, you know, as much as I've been and our organization's been yelling and screaming for 20 years, we're still fighting an uphill battle on that side. From a funding standpoint, we have a social enterprise. So we really feel like that as nonprofits, if they want to survive, they need to learn to build their own revenue streams. By the way, our garage on Halethorpe Avenue and Halethorpe on Washington Boulevard is open to you all. You can bring your car there and get it repaired. We'll charge you a lot less than you're going to pay anywhere else. And we have a garage on Greenmount Avenue in Baltimore City. And we generate money that way for our organization. What we see in Baltimore, I can tell you, for those of you who haven't traveled outside, is not much different than what we're seeing in other cities. We're in Detroit, Michigan, and there's the same problem.
That's right.
All the money in Detroit is going to the downtown area where Quicken Loans and where the pizza, thinking Little Caesars, but the folks who live out in the areas of poverty are being left further and further and further behind, and the same thing's happening here. And you know, fortunately, there's organizations and groups and convenings like this that are starting to recognize that. But it's not just recognizing it, it's doing something about it.
I think, so I'm at the early stages of this work, which is exciting to be with these folks who are, you know, their programs are growing and developing and doing such wonderful things. And I think the thing that I've been thinking about a lot, among other things, is this question of who should be at the table. And so being very deliberate in terms of thinking about how returning citizens can be a part of the work at Towson. So like my earliest conversations were with folks in HR, but also in terms of financial aid. So if we have students that could be creating work study positions, for example, to do this work. So not thinking about, moving beyond tokenism and those kinds of things are really important. And from the very beginning, so I do a lot of work in Jessup Correctional Institution with a group there called Positive Change. I've been meeting with them for about 4 years, and I often joke with them that they're my board of directors. So they're the ones that hold me accountable and that I can get feedback from and hear their experiences, and so they read my materials, and I think that that's something that is a priority, right, in terms of who needs to be at the table, who needs to always be at the table, and not just be at the table in the sense of kind of utilizing free labor or whatever, but thinking about creating positions that are paid and valuing the skills that those folks are bringing to the table, and being really deliberate about that from the very beginning, so it's built into the infrastructure. It's not easy to do, so I think also this isn't quite the question you were asking, but the humility that it takes. So like this work is hard, and I catch myself doing things and thinking things that you know, I might be embarrassed about, but not becoming discouraged about doing it, and surrounding myself with critical friends that will hold me accountable. So I think those are the things I wanted to emphasize.
Good afternoon. I'm Wendy Blackwell from the Center for Urban Families. And Mr. Schwartz, thank you for mentioning the need for collaboration and the work that you do with the Center for Urban Families. And Dr. King, I was very taken by your remarks about the people who work on the ground, who are doing work in communities who are not able to be grant funded because they're not there yet. And I'd like to offer that the Center for Urban Families under the Practitioners Leadership Institute does just that. So for many years, we've had the institute that looks after national practitioners and make sure that they have capacity building. And through the work of N.E. Casey, we're now working very closely with the University of Baltimore, the Community Law Center, to lead grassroots Baltimore leaders through a capacity building academy so that at the end of their 7-month work with us, that they have a legal structure whereby they can apply for funds or have a fiscal agent with Fusion or Strong Cities Baltimore. The work that we've seen over the last 2 cohorts has been extraordinary, very much like your work, Lynn, with the weekend backpack. We have people who are building small homes and shelters for people in small to more homes. We have people who are working with returning citizens and fathers who have child support. And these are your everyday citizens who are what I call right now passion projects that are turning into real operational work to change the trajectory of Baltimore. So I encourage you, and I'm going to reach out to you later to make sure that you know about it, that you know about the program, and you know about the practitioners who are doing just what you said to do, getting ready for the bigger call.
Any other questions? Yes.
Thank you. I think that the spatial analysis data of the HDI was interesting, and I was wondering if it specifically inspired anything within your own organizations or thought changes that you might make based on what was provided today, or I don't know, just ways to use it in your own work that might inspire myself or others to use it in their work.
I thought from the perspective of hunger, I thought it was fascinating. And when our organization began, we first looked at only Title I schools. And we're only looking to perhaps support kids who were in Title I schools. But what I've learned is hungry kids are everywhere, and they don't have to be at a Title I school. So for us, not all of our schools are Title I. So I think it's an interesting, I thought it was fascinating, your maps too, because I saw where most of our schools fit in, but we have a few outliers.
Yeah, for us, we're certainly going to use the information that was provided to help drive forward the idea that we've got to do something about transportation. It's nice to have somebody else put that information on the forefront as opposed to us having to do it all the time.
All right, I have time for one last question that's, oh, wait a minute, I'm getting a sign that that's it. It's Bobby saying, stop.
Stop.
Anyways, thank you so much. This has been such a fascinating discussion.